Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for tongue disorders. What is tongue? Tongue is a musculo-membranous organ of which mucous membrane covers the whole surface. Upper surface is covered with small tissue called papillae. Numerous taste buds lie in between the papillae. Buds provide us with various tastes. Further, tongue helps in chewing and swallowing of foods and drinks, as also speech production. On the right hand side, a healthy tongue picture has been demonstrated with papillae. The buds are not visible, these are very fine structures. What are common tongue disorders? Thrush, glossitis, geographic tongue, macroglossia, tongue tie, leukoplakia, black hairy tongue, tongue cancer. One, thrush. A type of yeast infection appear as white bumpy patches on tongue. On the right hand side, top picture of oral thrush has been shown. This is the actually thrush. Symptoms: patches can be wiped off, leaving raw red slightly bleeding surface beneath, loss of taste. Glossitis, inflammation of tongue. Please note, geographic tongue is a type of inflammation. Causes: vitamin deficiency, irritants like hot food, drinks, injuries, infection from microbes, allergy, dry mouth, etc. Symptoms: problems in function of tongue. Actually, glossitis, there are so many types of glossitis. This is a normal tongue. This is say desquamative glossitis, folded glossitis, candida glossitis, ulcerative glossitis, phlegmonous glossitis, median rhomboid glossitis, atrophic glossitis. All are glossitis, different types. But for the sake of information I have provided, this is not so much required. Glossitis means simply inflammation of tongue. Geographic tongue, irregular patches on tongue surface. Causes: idiopathic, that is not known. Idiopathic is not known. Symptoms: smooth, red, irregular patches, may suffer from soreness. This is the picture for geographic tongue. Number 4, tongue tie. Frenulum, the connective tissue between floor of the mouth and bottom of tongue, is short and thick. This is called frenulum, which keeps the tongue attached to the base of the mouth. Cause: exact cause not known. Problem appears to run in families. Symptoms: babies have trouble during breastfeeding. Elders find difficulties in speech. Leukoplakia, patches on tongue inside the cheek. Cause: exact not known. Maybe due to dentures, that is various gadgets that we use on our teeth. From addictions like chewing tobacco, snuff, smoking, drinking much alcohol, etc. Symptoms: white or grey, uneven raised tough patches, difficult to be scraped off. Occasional precursor of malignancy. That is the important thing, mind it. Leukoplakia sometimes is generally benign, that is not dangerous, but sometimes it may be a precursor of malignancy. That is, cancer may start from this type of skin infection also. Disease also. Macroglossia. Macro means big. Tongue is larger than normal. Causes: inherited, acquired disorder like diabetes, acromegaly, Down syndrome, etc. Symptoms: speech production and other functions hampered. Black hairy tongue. Exact cause not known. It is suggested that some person do not shed dead cells from top surface of tongue, leading to piling up. This subsequently appears as dark hair. Symptoms: blackish, brownish, greenish, yellowish appearance. Various type of appearance there. Halitosis is there. Halitosis means bad breath. Hairy appearance. Tongue cancer. A type of malignant head and neck cancer. Causes heavy smoking, taking alcohol much, chewing, pan pora, gutka, etc., oral sex, human papilloma virus, etc. Symptoms: red or whitish patch or ulcer or lump that does not go with treatment, nagging throat pain, numbness, burning pain, etc. This is tongue cancer. When to consult a doctor in tongue disorder? If there is any disorder that persists over a month time, especially if painless, one must consult a doctor. How to avoid tongue disorders? Brush and scrape tongue regularly. Rinse well whenever something is eaten or drunk. Check color of tongue. Normal tongue color is light pinkish with a little white coating. If there is persistent different color, consult doctor. Take green tea regularly. Green tea is a very good thing for tongue. It keeps the bacteria off. Drink water 2.5 liter or 3 liter a day. Avoid all sorts of non-smoking tobacco like pan, pora, gutka, etc. Keep addictions under control, though it is better to shun all addictions. Now we are taking remedies. Calisanitis for tongue disorders. Cancer, ulcer or lump on tongue with induration of ages. Sudden sinking of strength, power of speech lost. Use low potency 6 every 8 hours to fight continuous burning pain. That is in acute stage. Thereafter, depending on situation, make second prescription. That is, next medicine will come depending on the situation. There's arsenic album for tongue disorders. Tongue full of burning eruptions. Patient feel restless, suffer from fear of death. Drink water a sip or two, often worse during midnight and midday. Unhealthy, easy bleeding gums, bloody saliva. Acid fluoric for tongue disorder. Tongue covered with syphilitic ulcers. Sex passions and desires increased at night with erection. Patients indifferent towards those loved best. Albumin for tongue disorders. Glands about neck indurated and enlarged. Indurated means hard. Dry, burning tongue with feeling of ulcer on tongue. Feeling of pricking pain towards base of the tongue. Acid mur or muriatic acid for tongue disorders. Psoriasis of tongue. Ulcer returning again and again. Tongue swollen, dry, leathery, paralyzed. Hard lumps and epithelioma. Epithelium is another type of tumors. Aphthous ulcers in mouth. Halitosis, tongue cancer. Halitosis, you know, there is bad breath. Taraxacum for tongue disorders. Mapped tongue covered with a white film. Feels raw. Patches leave red. Sensitive spot. Appetite gone. Bitter taste. Salivation. Costigum for tongue disorder. Tongue paralyzed, inflamed, cancer of tongue. Tongue coated green. Look, topmost picture image. Patient too much sympathetic of others suffering. Mercurius for tongue disorders. Apathy on tongue. Imprints of teeth on sides of tongue. Swollen, moist, heavy, cracked tongue with much thrust. Painful as if chapped or feels burn. Ranula. Ranula, I've given a picture here, ranula. This is the ranula, means some sort of cystic tumor which contains saliva. It is generally comes out from one of our in mouth, you know, there are 3 pairs of salivary glands. That secretion of glands is contained within this cystic tumor, ranula. Acid nitrogen for tongue disorders. green coating with profuse taalism. Taalism means salivation. Tongue so sensitive that even milk causes smarting. Deep irregular ulcer on edges with tough ropey mucus. Saliva for tongue teaser. Silesia for tongue teaser. Numb sensation as if a hair on forepart of tongue. This is a very peculiar symptom in silesia. It's a very important symptom of silesia. Sensation of a hair on tongue which doesn't go after a lot of try. Ulcers on right border eating into it and discharging pus. This is a type of cancer here also. Patients catching cold easily, fond of warm dresses even in hot days. Silesia patients are very much chilly and they lack body heat. So this symptoms is also a general symptoms. With this, the video ends. Thanks for listening and viewing. If you got any problem, please write down in the comment section. I'd certainly respond.